Ready.
All right, so we're joined by a nurse practitioner, Monifa Beal-Horton, here in the Jackson area, graduate of Murrah High School and so many other places with so many certifications. We thank you so much for joining us. We got a room full here with us at Velma Jackson High School. We're in the Health Science Career Cluster, and we're recording this for all of our friends in Madison County schools: Rosa Scott, Madison Central, Ridgeland High School, Germantown High School, the Academic Options Center, my friend Mary Slaughter over at our Madison Career and Technical Center, and our YouTube channel. So thank you so much for taking some time for us today to talk about this incredible field.
Awesome. Thank you so much for having me.
All right. So before we get into what all it is you do and what all the different careers in a healthcare setting, you did go to Murrah High School,
I
and then
did.
Holmes Community College. So take us through your educational path, because we have a great relationship with Holmes and Hines, and I know several students are interested in doing the community college route.
Awesome, awesome. So first of all, I'll say that community college is great. It is not shameful. So don't let anybody tell you that it is shameful not to go to community college, because guess what? We all need a little break, and we need to understand that sometimes big college may not be for everyone. But let's go a little bit through my educational background. Like Greg has told you all, I did graduate from Murrah High School. I was the senior class president, and no, I did not graduate in the top 10. I graduated maybe in the top 25, like top 25. So I consider myself as, smart, but I was well rounded. Um, um, I didn't test well, so 18 was all I got on the ACT. So I said, okay, I don't want my parents to pay all that money for me to go to school, and I may not make it. But not that failure is an option, but I just wanted to be truthful, and say, okay, well, am I going to do my best? So when I went to Holmes Community College, all my friends were going to Hines, and I wanted to go the opposite way because I felt like I needed a new beginning. Not that I was bad or anything or not like that, but sometimes we get complacent of being around our friends all the time. And when you go to college and you meet new people to have lasting relationships. And that's what you go to college for, as well as, of course, to get your education. But I went to Holmes Community College. My major, I wanted to do sports medicine. Um, Although my mother is a nurse, my mother's also a nurse practitioner, as well as she has her doctorate as well. So I said, oh,
Wow.
I didn't want to be a nurse. I was like, I'm not doing that. That's not my thing. But I ended up, of course, I'm here. So I um I did sports medicine. I walked on with a athletic scholarship because I was the only person at the time who wanted to be an athletic trainer. So I was an athletic trainer for 2 years. But my major was secondary physical education, because I kind of looked at sports medicine and I saw where I needed to be or what classes I needed to take in order for me to either go actually nursing or sports medicine. So I kind of intertwined them. I made sure I talked to my advisors for sure, to see where I needed to be and where was my next step. So of course I began school with the end in mind.
Yep.
Uh, and that's what I talk to children, well, kids, mine as well, to say, hey, you have to know where you're going and know that you have to work toward the end in mind. So I got that scholarship and I did extracurricular activities. So I was in SGA as well as the choir. So I ended up with another scholarship. So guess what? I had school paid for because I was in extracurricular activities. And even though I didn't play a sport, I did, but I went to school to be the healthcare person for the sports people. So
Wow.
yeah, so that was my beginning. And when I left there, I said, okay, whoever gives me a scholarship first, that's the career path I was going on. Um, and Alcorn State University gave me a chance to redeem some past failures in my first year of school. I ended up getting an F in zoology. I didn't even need it. And so I was like, you got to be kidding me. Like, this is really keeping me from having a 4.0. And so from that semester on, y'all, I learned, if you see that something's not working for you, you talk to somebody. Don't be afraid. Um, 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 we all fail sometimes, but we fail forward. We fail moving forward, not fail falling behind. So, if that's one piece of advice that I could give you all, is that if you see that you're not going in the right direction, talk to somebody. And when you go talk to them, say, hey, like, be truthful. Look, I tried my best, or I didn't try my best. What else is it can I do to move past this? Or can you help me go to the next step? So so after Alcorn, I went to Alcorn, did my thing. They paid me to go, and I still did sports medicine when I was at Alcorn. So I was able to stay in the Natchez campus, as well as go up to what we call the yard, and be with the sports teams. And so I kind of got on the job training, and my heart is always taking care of people and have healing hands. So that's kind of just what I kind of went with. And I'm here now as a doctorally prepared nurse practitioner.
That's
Um,
incredible. But one thing I really wanted to hit on is that, again, like we said, I have so many kids tell me, I want to be a nurse, I want to be a nurse, I want to be a nurse. Nursing school is hard. I don't care where you go, whether you go to a top tier school or a community college or what. It requires a lot of studying, a lot of hands on, and it's going to prepare you for the realities of healthcare from the beginning. And I always say, when I have somebody tell me they want to be a nurse because they see the pay, that's great, but you got to be able to deal with blood. You got to be able to deal with bodily
Good.
fluids. You got to be able to
Hmm.
deal with smells. You got to be able to deal with injuries. You
And
got
you got
to,
to be able to deal with the
unfortunately,
family members.
yes, and sometimes you got to deal with people that have passed away. So, not trying to scare anybody, because it's a
Right.
great field and a rewarding field, but just doing it because you see it pays a lot can be extremely taxing on your mental health if you're not prepared to see
if
those
you're
types of
if you're
things.
not prepared. Yeah, I would tell you one thing. I've had students come to me for me to be their preceptor, or just to talk to them about the nursing field. And I say, hey, yes, the pay is great, but it's the other stuff that will either make or break you. You There's guts, there's snot, there's trachs and body fluids, and all of that, broken bones, and a splinter, I mean, from the least thing of a splinter or a broken toe, to somebody's neck being decapitated, and you may have to take care of that dead body. So there are different avenues in nursing. There is trauma nursing, there's pediatric nursing, and the same things that the adult trauma nurses have to deal with, they have to deal with the children. And that's a lot. And then if you are not strong in that, then hands-on nursing care may not be for you. So you have to you have to go to the trenches before you move to, like, those glory positions, and especially with going to do travel nursing. A lot of people are trying to get in it for the travel nursing, but think about it. You're going travel nursing because somewhere at that facility they have treated the patient not patient they've treated the employees not so good. They may be in the worst conditions, they may be in the worst, you may have to deal with the bare minimum. And you have to be resourceful, you have to know your stuff. You have to be able to critically think, you have to be able to think on your feet. And being able to, okay, well, we got a code going on, so what's next? You don't have time for what's next. You got to just go with the flow. Like, we got to keep compressions. We got to do compressions. We may have to push medicines, and you have to be the eyes and the ears of the doctors and the team. So, and when you're floor nursing, whether you're a male or a female, we love males. Okay, yeah, we love them. My
We'll
nurse,
definitely get to that in a second.
one of my nurses is a male, but for sure, you have to be ready, just like I'm pretty sure your parents may say, hey, well, what did you do today? How is this and this is and that? And all you say, oh yeah, we learned something new. Like, no, 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 no. What did you learn? And how did you learn? So you have to, like, nursing is application. You have to be able to apply the knowledge in everyday life, hands on. It ain't no now mind you, y'all, yeah, I am the worst about body fluids, but I can deal with it. Okay. I can deal with it if I have a patient, because I used to be a emergency room nurse. So I'm a need for speed. I'm a need for speed. I'm like Fast and Furious. Like I like all that fast paced stuff.
Yeah. Also, you're having to deal with all that, but the person you're dealing with could probably be extremely scared.
Extremely
So
scared. And you
even
have
if
to
they
be
are in
there
good
for
hands,
that
this is something
patient.
they never dealt with.
Right. And then you have to be there for that patient. Sometimes it's what we call advocacy. So you have to be the eyes and the ears and the mouth for that patient who can't speak for themselves. And then you also have to do it outside of your racial bias, the biases of, okay, well, they were in jail, so they deserve to die. No, 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 no. They're a human being first. And no matter what they did, no matter what that we say, the substance abusers, the crackheads or whatever, they're still people first. And so we have to we can't treat people, by their circumstances. We have to treat them as who they are right then and there. And so
Absolutely.
yeah,
Now,
absolutely.
talk a little bit about, and I know some of these programs are available at community colleges.
Hmm.
There's, if somebody's like, okay, well, I thought I wanted to work in the health field, but all that stuff's gross. There are literally thousands of other jobs that deal with the care of patients that don't necessarily have all the gross stuff involved. There's always a need for techs. There's always a need for people in the labs. We've had some Velma Jackson alums done the pharmacy program when
Hmm.
they had to mix the IVs and handle the medication. So talk about some of those other jobs that we also need a lot of good people for.
Yes, being in healthcare is not just being a nurse or being a doctor or being a nurse practitioner or even a PA. We have the hospital has to run, your clinic has to run. So you need people who are biomedical techs, which means you are dealing with the equipment. You're making sure that our equipment works. You can get a degree in biomedical technical engineering, and you can get a degree in industrial engineering. That's making sure that the pipes work at the hospital. That's making sure that the structural parts of my office is working. Um, you need laboratory techs, phlebotomists. You need people in the lab that are they're called medical lab technicians, and you can get a degree in that. You can get a degree in looking at specimens all day long. Clinical specimens, if you want to. A radiology technologist, a a, um, a CNA, um, a medical lab, a medical assistant. Let me see. We got some other people. We have surgical techs. We have what we call processing, and they make sure there are they make sure that we have tissue. They make sure that we have our supplies. So our supply
Yep.
people. I mean, like for real, like there's somebody that is called it's called a chief of medical supply. So you are helping the healthcare facility move forward by making sure that none of our supplies are outdated. We still have to use tourniquets. We have to use blood lab samples and all of that. And you can help and be in the healthcare field by just being a medical lab person or a supply tech. Excuse me. So yeah.
Yeah, and also there's a huge need for IT and software people with the
Hmm.
growing use of technology in the medical field. Health informatics. You got to have people to manage the database. You got to have people to manage the security of the system. And there's literally always an IT person at a clinic, at a hospital.
Absolutely. We have a whole department. If my computer starts glitching, even though I'm a little techie, I'm gonna try to fix it myself first. But then if I feel like it's a software issue, I'm calling like, hey, y'all, this is this is keeping me from doing patient care, and I need somebody here like right away, you know. And most of the times they'll come right away because they know that I don't call them that often because I like computers. But there are some people that that they need, okay, tell me how you do it. And so, your computer system has to be working. And so we need people in IT. We need people in learning how to do like coding and things like that. So STEM, y'all, STEM is where it is. Um,
Yeah.
the graphic arts. I mean, we have people in our front office. They do announcements every day, but they're making sure that the operations of the hospital are are um are going. We have a person that does our PR. So you can't just get a doctor going in there to do PR for excuse me, PR for the hospital. And they don't know what they're talking about. Like, no, mm-mm.
Yeah, and then also you need people to operate the CT machines, to operate the X-ray
Oh,
machines.
absolutely. The
With
CT.
all these new advanced technologies, you got to have somebody that knows those machines left and right. And
And you
those
even
people are paid well, and they're extremely important. So it's like you said, it's not just a doctor or a nurse in a healthcare setting.
it takes a whole crew to let this place run. From our janitors to the people who the police officers. You know,
Yeah.
um, it's it's not necessarily a one-stop shop, but it's rewarding. It's rewarding if your heart is in it. So I mean,
Yeah,
so
and another thing, as far as at the hospital, some people like working overnight. If you're not a morning person,
yeah,
these places are always looking for people that want to work overnight.
yeah. Overnight, you have to be had to be very independent because you don't have a lot of hustle and bustle here in the hospital, and so it's kind of that downtime, and it's like, okay, all the eyes and the ears, all the big people not here, so you got to do your work. You got to do the work, and if you do the work and the patient is safe and they're sleeping sound, if you give them medicine or you turn them and things like that, then you could have probably pretty easy night. But sometimes like yesterday when the solar eclipse and the moon, it gets wild, y'all. It gets wild.
Yeah, but back in October, I actually had a 1 week hospital stay myself,
Hmm.
and the nurses that I had at night, that, like you said, there weren't as many people there. They had to know exactly what was supposed to be in my IV. They had to know
Hmm.
exactly what medication I was supposed to have after my surgery, and then something I never thought about because I'm not in the hospital a lot, but you have nutritionists there to have to make sure somebody's not going to die of a food allergy when they had to be
Correct.
fed in the hospital or have to get a certain type of thing to go with the medicine. There's so many things that
Yep.
really come into play.
And being a nutritionist is we have a whole nutrition department. And so and unfortunately we live in the fattest state, the most unhealthiest state in Mississippi. I mean in the United States, and we're number one where we shouldn't be number one. But being a registered dietitian or being a registered nutritionist, um you're helping somebody. You're helping somebody win. You're helping somebody win with their health, and you're helping them, either lose the weight or gain willpower over food and things like that. So if being a nutritionist or being able to talk to somebody, we also have social workers as well too. So
Oh yeah,
social workers make the world go round. And I love my social workers, all of them. They help us find resources for our veterans. I didn't tell y'all I work at the VA. Never imagine a million years that I think that I would be working across the street from my high school, but I work with veterans every day. And I enjoy my job. I
that's
enjoy
awesome.
it.
Now, something we alluded to earlier, and I think is important, is you said men in nursing, and I know every female nurse that I talked to has said if we could just get more men to be nurses, it would be so much easier. And I know you're very passionate about that as well. This is a career field that has changed in the last 40 years.
It
Just because
has.
back in the 60s and 70s it was all women doesn't mean that men can't do it now. Because, like we said, you can make really good money doing this, but we
Hmm.
need men to get into nursing, and it's just for a variety of reasons.
Yes, for a variety of reasons. Um, um, it's like a male that's in nursing is like it's like gold. Like, hey, we love them. um, we love them for, of course, their brute. We also love them for being a being an estrogen barrier, like you breaking up all this estrogen with these women, and the men come in and be like, hey, y'all, we ain't got time for all that. Let's get work done. But men also bring a different aspect or a different perspective to health, as well as just moving around. There are men in leadership positions. There are men who are working hands on, just like men being teachers. We need men to be teachers. We need men to be. I have a best friend that is a nurse, and he's a male, and um, too often most of our males, they move up the ranks quicker, because we soft-hearted ladies, we like to just chill out, and but sometimes our men, they have another agenda. My cousin is a nurse, and I was proud that he graduated from my alma mater. I was proud that he continues to be a nurse, and guess what, y'all, he still wear his goals on the weekend. So he wears his braids. He wears his golds. I mean, hey, he he's my fly guy. But don't let being a male nurse, don't let being a nurse deter you, or the stigma of, oh, that's a girl thing. No, it's not a girl thing. We need men, just like we need men in medicine. So it's the same thing. We need men in medicine because most of our population, they're getting older. A lot of times there have been more males born than females. So we need that, just like it it warms my heart to see a male figure in the public school system and doing the things that you're doing, Greg, and I applaud you for that. And you all should be very blessed to have a teacher um who wants you to know more, and wants you to know more, and to encourage you to be your best in anything that you do.
Well, I appreciate that, but
Mhm.
it's never been about me. But
Right.
I
It's
do
about the
appreciate
kids. It's about the
that.
kids,
Uh,
but it's your heart that makes you who you are.
Well, and I appreciate that. And just to piggyback on what you said about the men, I had a classmate of mine who's over at Methodist Rehab, and she said when we get a guy, if it's a quick situation, we don't have time to look for a stepladder if we can't reach something. If we
Hmm.
have a very large person, we might need help moving that person. So, and another friend of mine, he's at St. Dominic as a nurse, and he said he gets job offers every day.
Yep.
And another cool thing about the health field is that a lot of these jobs, it's a great way to train for the next step.
For the next step.
Several people that are nurses were CNAs first, so they got a lot
Hmm.
of hands-on patient care and were able to shadow nurses. Another friend of mine who just became a doctor, and he's in Pittsburgh now. He spent years as an ER nurse, and he said med school was a breeze. So
Hmm.
you can work full time while you're furthering your education and furthering your career,
Absolutely.
and you're still making a really good living while you're doing that.
Absolutely. I mean, actually, one of my football players from Alcorn, he went to nursing school, and when he finished nursing school, guess what he did? He went to medical school, and he's now, and I'm sorry, no, when he finished football, he went to go play in the NFL, and once he finished NFL, he went to nursing school, stayed a nurse for about 3 or 4 years, and immediately went into medical school, and is now in a cardiac neuro big bank something in New Jersey. So like he went the rank. So it's not to say that if you are an athlete that you can't go further outside of your athleticism to be a brainiac here. So
Yeah,
absolutely.
and it really is if you're a team person and like being a part of a team, this could be a great field to get into.
Absolutely.
Well, I do have some questions from the students, and these are really good. I get to as many of these as I can.
Okay.
This first one is to Davian Smith. He's a ninth grade member of our band here. He asked, "Have you ever been too sick or too traumatized to continue to work on a body?"
Mm, um too sick as in like body fluids or
Yeah,
like
it was too gross, and you had to walk out.
um no, because I like gross stuff. Other than well, there was one time that honestly I was in the ER. I was pregnant, and I was eating my oatmeal, and I had a patient come in, and he needed like to be suctioned off of the trach, I just kind of like I say I need somebody to come help me. I need somebody to come help me because I knew at that moment that me eating my oatmeal, I had just ate my oatmeal and saw that. I was like, can somebody come help me? But I recovered and I finished seeing the patient. But I did have somebody who was willing to be like, okay, let me take up your patient for you while you go to the restroom. So, but
Yeah.
like gore and all that stuff, like, nah, I like that Freddy Krueger stuff. Like, yeah, I'm one of those type people.
You should have heard those reactions you got when you talked about you like gross stuff. This is Alayla Jones. She's in ninth grade, one of our volleyball players here, and also in our band. And she
Okay,
asked, "What are
bad
the most?"
girl.
She said, "What are the most common injuries you've seen, and what's the hardest injury you've ever had to deal with?"
Mm, the most common. Okay, so like right now I'm in primary care. Prior to me becoming a primary care, like I say, I was in the emergency room. Um, the most common thing that I have ever seen, pretty much was like an ankle dislocation. And it wasn't bad. I mean, you know how the chicken wing, the chicken bone, it folded like that. And I just remember having to
Oh.
take take one of my boys off the football field and kind of try to help set that back in order for him to get situated at the hospital for orthopedics. um but yeah, that's pretty much it. I mean, but right now, since I'm in primary care, of course I see a lot of patients with hypertension, diabetes, um um strokes every now and then. uh that's pretty much it. Just because of our population.
All right, this is Ashton Job, and he asked, "What made you change to nursing from athletic training?"
Um, Alcorn gave me a full scholarship to come because I was a transfer student. um, uh, but athletic training and medicine, I'm not medicine, but nursing kind of go in the hand to hand. But so, like, say if I would have stayed in a continue to do athletic training or either went to nursing and found a job in orthopedics, that would have been my avenue. That sports medicine would have been my avenue to go to orthopedics. And so with nursing, you can be an orthopedic nurse, you can be a nephrology nurse, what they deal with kidneys, you can be a urology nurse, what they deal with the urological system. You could be a pediatrician. I mean, not pediatrician, I'm sorry, a pediatric nurse, what they deal with the kids. You could do emergency medicine, you could do cardiology, you could do geriatrics, which is our nursing home. So you have different avenues, and basically you got to get that 1 degree before you move on to the next type of the next specialty, and then get kind of trained in that specialty. And guess what? You can move around. You can move
Yep.
around. Nursing is a field where you can move around every 4 years, every 5 years, every 3 years, especially if you want to do something different, and never be afraid to do something different. One thing they can't take your license if you don't surrender them, which means is if you don't mess them up, then guess what? You can continue to practice as a nurse or a practice as an advanced practice registered nurse is what I do. So that's what made me go that way. But I still find myself going into sports medicine because all of my kids are in a lot of sports, and I'm usually that parent that's there. And if I see somebody fall out of a stunt, in which I have, they broke a wrist, and I'm like, oh, hey, girl, let's see. And I can't show emotion because I can't allow that child to see the fear on my face. So, and if you're an emergency room nurse, you can't allow your patients to see the fear, regardless of the situation. Yeah, it looks dim and bleak, but guess what? You gotta have that smile on your face, and it's it's stressful, tiresome, but like I say, it's rewarding, and it just depends on
Absolutely.
you. It depends on how you look at life. Yeah.
I love this question. This is Tierney Kirkland, one of our basketball players here. And she asked, "On your first day on the job, was it scary?"
Yes, absolutely. Because I didn't know, even though I just graduated, I was like, I don't know what in the world I'm doing, you know. But because I had good people around me, I had good people to teach me certain things, then I felt like I was on top of the world after that day. after that day. But I was scared. I was scared. Absolutely.
I bet. I love this one. This is Alonzo Green, member of our band here, and he asked, "What skills are most important for someone who wants to work in the medical field?"
Listening, have good listening skills, dictation as in listening to what they're saying and being able to verbalize it back or regurgitate it back. So you need listening. You need good scientific skills because you got to remember, when you're in nursing school, you miss one day, honey. Let me tell you, or even in medical school, you miss one day, you've missed the whole system. Okay, because in nursing school we kind of go kind of fast, and just like if you take human A&P, you kind of get a glimpse of it because human A&P, they may go over the skeletal system today, and then by Friday we've moved on to the skin. And every system is big, so you gotta have time management. You gotta have critical thinking skills and mathematical skills as well, because you still do have to do some type of um, uh, calculations for medications, even though our pharmacists kind of help us do that. But you still have to know what you're giving and why you're giving it, and those side effects of the medications you're giving, and hopefully it won't react to the other medications that the patients have.
Absolutely. Let's got a couple more. This is Edward Flowers. He asked, "What has been the most difficult part of your journey so far in your career?"
Um, let's see. Not getting a job because I'm a female, or not being rewarded for the hard work that I've done. Um, that's pretty much it. I mean, I've had people. I mean, COVID changed a lot of things and a lot of perspective. But because I was an emergency room nurse and kind of like I know who I am with my faith. No, I'm not afraid to die. I know I will die one day, but sometimes, not being quote unquote cold hearted when people die. I may not cry as much, but my brain always switches to, are they not in pain anymore? Or would I be selfish to have allowed that person to stay, or family members to stay, and knowing that they have lived a gorgeous life, or even if they lived a
Absolutely.
hard life. It's like, okay, do I want do I want the responsibility of taking care of that person, and they can't help me take care of them, or um allowing them to rest, and like really rest in peace, and rest in the arms of
Absolutely.
heaven.
I, I just got one more. This is Jernylin Fleming Nash, also a member of our band. And she asked, "What is the biggest challenge someone will face when they get into this career?"
um it has been said that nurses eat their young, which means they try to make you tough. They try to make you tough. They try to see how tough you are. And so, getting people who are older. Okay, so there will be people that are older than you who may not have been a nurse as long as you, or you may have somebody in your nursing program. If you choose to go into nursing, you may have a classmate who is 65 years old and just had a whole career change. But just because they're 65, does that mean that they can talk to you any kind of way? No. So you will get that, and you will have to, as y'all say, stand on business, but being respectful. Uh, so as long as you know what you know, and you have done you've done your background on, or either if you know that the nursing assignment that you're taking, and those patients been on the floor for the last maybe 3 or 4 days, and you've done your research on them, and say, okay, hey, I know what medicines to give. You may not know everything, but it's okay to ask questions. So I mean, I will say that, so don't be afraid to ask the question. And even if somebody snap off at you, be like, look, we here for the same thing. We're here to treat the patient, but I'm here, and you will get that. You will get people who will just be snappy with you just because. And I mean, and it's not right. No, and I'm not I'm not saying it is right at all because it's not, because I don't play that around here. Um, I don't. It's like, hey, I asked you to do a job, and if you can't do that job, I'll let your supervisor know that you can't do the job, and then you can't work with me no more because
Yeah,
we can't go there. We can't do that. So, so just know that sometimes you will have opposition, and some of it is to make or break you. And facilities are hard. So, I mean, some places are hard to work at, and you just got to be you got to be strong in who you are, and strong in, like, you know what, leave the job at the job and have fun on the weekends or when you're off. But just always remember that you have a not necessarily a degree. You have your degree, but you also have a license, and you can get fired from jobs if you said something on Facebook, or you went out and bust that man windows out, or you done sliced her tires, so just know that you don't want that type of thing. So I had been in some situations. I'm like, you know what, I gotta walk away because I cannot lose my good government job, or I can't hurt my potential to have a good government job. Okay.
yeah,
So um so just be mindful that every choice that you make, there's a reaction for that
yeah,
choice, whether it's good or bad. And every time you make a choice, it's it's built on top of that choice. So if you don't never if you don't get nothing I'm saying, just understand that make good choices, and and respect yourself and respect the people around you, for sure.
absolutely. Now, one thing I did want to mention real quick is you mentioned COVID. I think COVID showed us how important respiratory therapists are.
Oh,
Um,
absolutely.
so right
Absolutely.
now,
And we
respiratory
have
therapy is a very good field to get into.
absolutely. And I have a friend who's a respiratory therapist, and he switched over and he became a nurse. So he kind of, work hand in hand, and you can be a respiratory therapist and been a respiratory therapist for a long time, and then switch over and do administrative work and go work for a home health agency. So your nursing degree opens the doors for you to do
Yeah,
administrative work. It opens the doors for you to do IT work. It opens the doors for you to continue to do hands-on, or even be administrators of nursing homes, hospitals, or even nursing schools. So whatever you choose, or whatever you choose, then just know that, hey, I can do more. I can do more. I can
absolutely.
do more.
Well, we're almost out of time, and we thank you so much for taking some time for us today. Just so many great opportunities that I think young people don't know about. So it's so important to the overall health of the community that we get good people in these positions. So why should these kids really consider getting a career in health science?
Is rewarding, and the world is changing. The world is changing. World Health Organization is changing. People, unfortunately, are always going to be sick, and we're always going to need somebody to help take care of them in every shape, form, and fashion, whether it's hands-on, whether it's administrative, and learning how to, of course, yeah, just dealing with people, for sure. It's rewarding.
Absolutely. Yeah, and you're always going to be in demand.
Always in demand.
Yeah,
Yeah, right now the demand is higher than the supply.
absolutely. Well, Monifa Bill, we thank you so much for taking some time for us today over
No
there at the
problem.
VA hospital in Jackson.
No problem. I appreciate it. And if y'all have any questions, you can tell Mr. Greg,
Absolutely.
and I'll be sure to answer them. Or if you need any guidance, he
We
can
definitely will do that.
all right.
Thanks for fitting us in your busy schedule today.
Oh, no problem. Y'all have a great day.
All right, talk to you soon.
All right. Bye-bye.